in Hindi for the moment. So we will start with the questions. We expect everyone to be short, concise, and have only one question. So if we are ready from the technical side, we will start with the Shanghai Media Group, and we have Bin Chen online. Hello. Can you unmute yourself, please?
Yes. Hello, can you hear me?
Yes, now we can hear you. Please go ahead.
Okay, thank you very much for the special guest speech, but my question is not related to this subject. Sorry for that, but thank you for taking my question. So today, EU announced its plan to invest billions in purchasing vaccines from pharmaceutical companies in advance to secure enough shots for European citizens, while Washington indicated before also that it wants US-made vaccines for itself. So my question is, how would WHO formulate guidelines on the allocation of vaccines in the future to ensure fair access to pandemic remedies worldwide, especially for underdeveloped countries? Thank you.
Tedros may wish to comment. In fact, Tedros leads a very important global group looking at these issues on a weekly basis, and had a very productive video telephone conference with many partners, including the European Union, last night. There are a number of initiatives around the world to secure vaccine for either single countries or groups of countries. We need to work closely with those initiatives. The ACT Accelerator, the Access to COVID Tools Accelerator, and the vaccine component of it led by CEPI, by Gavi and WHO, seeks to not only identify the appropriate vaccine products, but to accelerate their production, ensure that there are adequate stocks, and work across the whole partnership, political, scientific and manufacturing, to ensure that there is fair and equitable access to those. There are many ways to achieve that. Not one, I don't believe one single mechanism right now can do that, because a number of initiatives have already started. I think we have to recognise that reality, and I believe it's in the interest of the world that WHO and other agencies now work together with those alliances to ensure that everybody is pushing in the same direction, and that is the production of enough vaccine to meet the demands that we would have according to the strategy, and to ensure that we have fair and equitable availability of that vaccine to those who most need it. And Dr. Tedros has been pushing very hard in this direction and convening all players to ensure that everyone is aware of their responsibilities to contribute to this global good.
Thank you, Mike. This question is very, very important, and I will just add a few things to what Mike had already said. As you know, WHO and its partners have launched an initiative, which is the ACT Accelerator, on April 24. And you also remember that there was a pledging conference by European Commission on May 4, which was very successful and raised around $8 billion. And we're also working with, as Mike said, with all relevant stakeholders regularly, especially to address one of the two objectives outlined during the launching of the initiative, which is access to the product that we hope will be produced, or the vaccine that we hope will be produced, access by all who need the vaccine. Of course, we have already discussed in that platform of the meeting of the relevant stakeholders a draft allocation framework. But that draft or the allocation criteria cannot be implemented unless there is a global consensus on making any vaccine that will be found or discovered as a global public good. And for that to happen, we need political commitment. So a global consensus that's based on political commitment of our leaders will be very important. The good news is many leaders, as you have heard them say it during the launching, during the pledging conference, during the World Health Assembly, many leaders promoted the idea of making any vaccine that would be found as a global public good, but that should really be continued to be promoted, and more leaders should join the boat, and we need to have a truly global political commitment and global consensus before even we have the product. So that's what we're pushing, but of course it's not yet completed, but we hope the world will agree and we'll have a consensus to make a vaccine that will be found a global public good. So this will be the commitment of not only, by the way, the political leaders, but I think it's everybody's business too. And the voice of every citizen globally will be very important to assure access to vaccines and other products by those who need it. Thank you.
Next question comes from Spain. We have Pilar from El Mundo online. Pilar, can you hear us? Please unmute yourself.
Yes.
We can hear you. Please go ahead.
Okay. I have two questions. First, I wonder if you are considered making an universal recommendation for the return of the children and kids to school, basic measures, because the behavior of the transmission in this population is really unknown. There are different points of view. And the other questions, it's about if there should be a global unification of data accounting in order to make more comprehensive comparison of the situation between countries, about a confirmed case, suspected case, and death.
Okay.
Thank you.
I will repeat the question. So first one is if WHO is considering making a universal recommendation for the return of children to schools. And the second one is should there be a global unification of data in order to make a more comprehensive comparison of situation between countries. So Pilar, thank you very much for joining us for the first time. Normally we take only one question per journalist, but I'll let our speakers help.
Okay. I'll just, Maria will come in on this, but we have issued guidance and considerations for the reopening of schools, and Anshu, who's actually with us here today, is actively engaged with educationalists around the world and others, and we will be bringing further technical advisory groups together around the whole issue of school and risk management at school level. It is very difficult to give a universal recommendation around school opening or closing. As you can imagine, the contexts are extremely different, the epidemics are very different, the vulnerability of children in different settings is very different. A school is a very different concept in many parts of the world. The age stratification and what you do in young children versus older children versus adolescents versus universities. So it's very difficult to make universal recommendations. We have issued considerations and very detailed considerations for the risk-based decision-making that governments should make. But maybe maybe Anshu may have a comment on this. And maybe Maria can take the question on the bringing together global data.
Thank you very much. And so I think it's very important to highlight that we've seen negative impacts of closures of schools, and at the same time also we have seen that it has an impact on transmission. So what's very important for us is to identify better what the impact has been of closure of schools on transmission in the community, and that's something that we're looking at the moment. We have also identified that closure of schools has contributed or will contribute to poorer educational outcomes, to mental health issues, as already mentioned by a previous speaker, but also to poorer nutrition. Many children actually depend on a meal at school as part of for their nutritional status, as well as looking at the impact of violence against children, also highlighted earlier. So I think we need to really look at the balance. What is the risk or what is the impact of closing schools on the impact on children versus the transmission in community, and that's something that we're studying at the moment.
Thanks very much. If I could just briefly add on the first question around the considerations to reopen schools. As Mike has said, we have issued guidance around this because it is very context specific. And when taking that decision, there's a number of factors that need to be taken into consideration, including the current epidemiology and transmission or intensity of transmission of COVID-19 in the area where the schools are and where the children live that go to those educational institutions. And also the setting that the school is in or that institution is in. What is their ability to maintain the ability to prevent and control transmission of COVID-19? And so what we've done is we've tried to outline these considerations to help the decision makers take the decision of when and how to open those, looking into the school policies, the resources, the infrastructure that the school has, the policies not only for the school staff but for the students themselves, looking at the different behavioral aspects or the age considerations. Obviously for younger children there are different considerations for those that are at university or even in a high school level, looking at hygiene and environmental cleaning within the facility itself, looking at the ability of the system, the school system, to be able to screen for cases, detect cases, what is the plan if you do find a case through the school itself, education and communication through the parents and the students themselves, so not only talking to students but listening to students and feeding that back into the plan. And looking at the ability to put in physical distancing and other public health measures that also need to be taken into consideration. So as Mike has said, as Anshu has said, it's very context specific, and so to set one policy is very difficult. And so what we're trying to do is help the decision makers take those decisions to reopen schools safely. With regard to the second question around global data, so indeed we do have systems in place to capture data from countries around COVID-19 cases. We have the mechanism through the IHR where official cases are reported to us through the IHR mechanism. We have issued case definitions, which helps to define who is a suspect case, who should be tested, because as you know, our recommendation is to test suspect cases, and there's definitions for who those suspect cases are. And we have also issued guidance around surveillance systems. How would one find suspect cases, looking specifically at different populations and looking for cases in the community. And so the mechanism by which we capture that information is through IHR. And we have teams that are working to analyze the data that comes in to help us better understand the situation, the transmission situation, and the characteristics of the cases reported.
And we'll just ask if any of our speakers would like to add something on this first question on reopening schools. If you, I understand that Natalia would like to add something.
Yes, I think the question on data is extremely important. And I just wanted to remind all that the Global Action Plan on SDG 3, which relates to data and digital health as an accelerator of universal health, is something that WHO and UNFPA have been co-leading. And here the cooperation at the country level, where we never take our eye off of 2030 and the Sustainable Development Goals, even with COVID. The cooperation of country governments is extremely important as we strive across the 12 global health organizations, which are signatories